Okay, thank you. Hi, everybody, and welcome to this conference hosted by the MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined today by Tiffany Malone, who will be talking to us about the strategies for managing stressors successfully. After her presentation, we're going to open it up to your questions and comments, and now I'm delighted to introduce her. I know you all had an opportunity to hear her or to see her large in full bio, but this is just a little bit to teach you a little bit more. Tiffany joined the John A. Schaefer, MD, Multiple Sclerosis Achievement Center in November 2014 as the program manager, and she's now the director of the center. Tiffany has a master's degree in social work and is also an MS specialist. We love when she joins us, and we look forward to having her present this important topic. So, Tiffany, I'm going to say, turn it over to you.
Thank you so much. Thank you so much. I am thrilled to be back with you all. And thank you to the MS Foundation for having me and this series because something I'm very passionate about. So I will talk about it anytime. Let me share my screen and hopefully that will, let's see here. Give me just one second, guys. I am going to find, there it is. Technology these days. Okay. And we're going to do this. Okay. So hopefully everyone can see that. So as Deborah said, I am doing this series. It's called Mental Health Matters. And today we're going to talk about how to manage stressors successfully. You may be thinking to yourself, my goodness, how is that even possible? But we're going to go through it. We're going to break it down and hopefully you take something positive away from this and helpful and useful. I will forewarn you that I do ask for audience participation. So there's a couple of times where I'll ask you to include a comment or answer a question in the chat box. If you'd be willing to do that, that would be great. It makes this interactive. I'm used to talking in front of people in person. I love the virtual world because it allows us all to be together, but I also want us to still be able to engage with each other. So we'll be doing that as we move forward. Let's talk about the objectives. Hopefully by the end of this presentation, you're able to identify different types of stress. Yes, there are different types. That you'll learn the effects of stress, especially chronic stress, and how that can negatively affect us in most cases. We're going to talk about how to incorporate strategies to manage stressors. And then again, as I always do, I'll end with some resources that hopefully will be useful for you. So I always like to bring us all together so we're talking in the same verbiage. And so let's talk about what the definition of stress is. And the definition that I pulled from just a regular Google search there is that it's a state of mental or emotional strain or tension from challenging or demanding circumstances. That really, when you think about it, probably defines what you think of as stress, which is kind of that negative connotation to it. But I'm going to point out how that might not always be negative, but will still operate under that definition. And it's a response to external or internal stressors that can be physical, mental, or emotional. And we'll break that down in just a little bit. So I want to first start with that there is good and bad stress. So not all stress is negative. Not all stress is bad for us or unhealthy for us. There are some good stressors that we might experience. When those stressors happen, it's something that is motivating. It's something that could elevate your heart rate and probably does. It's something that sends a surge in your hormones and gets you kind of that excited, motivated to accomplish something. And it allows us to give more focus and attention to that particular task. It could be a challenge, but it gives more attention to that. And it hopefully enhances our performance because we're eager to get started. We're eager to get through it. We're eager to feel accomplished at the end of it. Bad stress, on the other hand, can result in headaches, weight gain, in some cases weight loss, so weight issues in general, increase in blood pressure. It can cause the emotional reaction of anxiety and trouble concentrating and trouble making decisions. And it can cause some sleep issues, primarily insomnia. But again, I want us to remember that if we go back to this definition of stress and it says that it's a mental or emotional strain or tension, that doesn't necessarily have to be bad. It can be tense. It can be challenging. It can be demanding. But again, when the good stressors are happening, it's giving us that increased excitement to complete or start to complete that task. But let's really talk about the negative stuff. And that's because we want to know how to live healthier lifestyles. We want to know how to manage this in a more positive and healthy way. So, what we need to know is what are those effects of stress? What does it do when there's too much bad stress? There can be physical ailments that present themselves. Chronic stress, so when we're under stress a great deal of the time, can lead to prolonged inflammation, heart disease, strokes, diabetes, and particular types of cancer. You've already marked the MS box. You don't want to mark anything else if you don't have to. So that's why it's important for us to understand what those long-term effects could be. Behavioral changes can happen. Again, we could have changes in sleep, appetite, as that image before showed us, that there can be weight changes, there can be insomnia, and it limits or changes our participation in social activities. Perhaps it even changes our desire to participate in social activities, which then leads to isolation. And if you've been with me before in a previous presentation, we know the long-term health effects of social isolation, and we really want to avoid that. It can also cause mental health issues. So it can cause mood changes, and it can really change mood for consistently. So it can make us feel like we're unhappy, that we're frustrated, that we're angry, that we're sad a majority of the time, no matter what's happening. And chronic stress can lead to the diagnosis of anxiety and or depression. Now, short term, we have to pay attention to this as well. Short term, physically, we can experience more pain. We can experience more discomfort. We can experience the perception that pain or discomfort is worse than it actually is. When we're under a great deal of stress, not just the circumstance is stressful, but then everything else that's happening in life becomes very stressful, even when it's not. But we perceive it to be so. So it's important that we're able to understand what's actually causing us the anxiety or the frustration, and not that it's everything. From a mental health perspective, it can lead to frustration, especially in the moment. We can be grumpy. Oh, when we're stressed, maybe we're a little bit shorter with people, or we're not as kind as we would like to be or that we would normally be. So that can be an indicator. And then again, it can increase short-term isolation, and we really want to be mindful of that. It can also lead us to think again that everything is bad. That you make a statement such as, I had the worst day. Did we really have the worst day? It felt like that, and we're perceiving it that way. But again, we are negating and neglecting the stuff that did go okay or even good. And so we're not even being able to see those things. And so it's really important to again, be mindful of that. So now let's break it down a little bit and talk about some of the different types of stress. And there are some different ones. So time stress. Einstein used to tell his audience that if they were doing something uncomfortable, time could drag. I'm sure we've all experienced that. I don't want to do this. I want out of this. I want this to be over. We're watching the clock and it's ticking by so slowly. But when we are experiencing pleasure or something that brings us enjoyment, time flies. And if you think about that, there's a lot of truth to that. When we're doing something that we're passionate about, that we're super engaged in, and we're enjoying ourselves, then you look at the clock and, oh my gosh, it's time for it to end. Oh, that's really unfortunate. Versus when we're trying to do something that we don't enjoy or that we're uncomfortable with, it just seems to take much, much longer. So time is a product of our thought. What are we thinking about, and how are we feeling about what we're doing in that moment and with our time? And again, it's important to recognize that, because if we are not spending enough time with things that we enjoy, then again, that chronic stress and that chronic negativity will set in. And then it turns out that nothing we do will be enjoyable because we're not seeing it that way. We're not experiencing the joy from certain activities. Live in the present. This is something that I really stress to people that I work with, kind of that be here now concept. When we're doing something, let's be present in what we're doing. If we're spending time with someone, let's truly be present with that someone. We can miss so much when we are thinking about something else, when we're worried about another activity that's coming up or a challenge that you're faced with. When we aren't attending to the task or attending to what we are participating in right now, we're missing so much of that experience. And we're potentially missing the good from that experience. And it's really important for this idea of rest and rejuvenation to happen. Not necessarily taking a nap, not necessarily doing anything like going to sleep or anything like that, but just really taking a pause and checking in with yourself to say, how am I feeling right now? How was that experience for me? Did I enjoy that? Do I need to make any changes next time I participate in that activity? Really reflect and give yourself a little bit of a break, just to recognize how you're feeling about it all, but also to make any adjustments that you need to make before you move into the next thing. And we live very complex lives. Living with MS is complex. Living with other health conditions is complex. Your life responsibilities are complex. So let's try to simplify as much as we can. Can we plan in advance? Can we prepare ourselves for the next day the night before, for example? I know something that I do is I make my lunch the night before so that if I'm running behind in the morning, that's one thing I don't even have to worry about. And just that one small thing that I do for myself to plan ahead is in some cases really life-changing, because it really helps me to be prepared for the day, even when the day isn't getting started on the quote unquote right foot. Make sure that I have this open too, just in case. Okay. Whoa. There we go. And so now let's talk about sleep stress. I'm not here to say that sleeping causes stress necessarily, but it's the lack of sleep. It is that insomnia. It is that I can't sleep. I'm not going to sleep early enough. My sleep routine is off. My sleep hygiene is what we call it, is off. And so let's talk a little bit about sleep hygiene and how to promote healthy sleep hygiene. The first and maybe the most important thing is to make and keep a routine. No matter what your schedule is throughout the week, if you keep a somewhat mostly consistent sleep schedule, I promise you it will pay off. Because what happens is that if your sleep schedule is off and all over the place, and then suddenly you need to be up for a doctor's appointment or up for something for work or whatever the case is, your body isn't necessarily going to react very positively for you. And that can really throw things off when you're not ready to fully participate in what it is that you have scheduled. So when we set and keep a sleep routine, we allow our body to learn that at a certain time, it's time to go to bed. and at a certain time we get up, even if there's no appointment or schedule that I have to attend to. It helps us get the true rest that we need when we are sleeping. And so that does mean that we are setting times to get up and to go to bed. The rule of thumb for intake of food and drink is that you limit and stop those things at least 2 hours before you go to bed. That's for a couple of reasons. You want your body to be able to have time to digest food while you're awake, not while you're trying to go to sleep. Because when you're digesting, your body is working, and it's going to be much harder for your body to be in that sleep state if it's trying to work. Food or drink, excuse me. Well, plenty of us get up all night long to go to the bathroom. So let's try to reduce the amount of times we have to do that. And part of that is limiting fluid intake at least a couple of hours prior to bed. Hopefully you are learning your own body and what your needs are, especially with the restroom. So hopefully you're pacing yourself throughout the day and not consuming in chunks of time, unless you don't have access to a restroom and you need to do it that way. Again, the rule of thumb about your bed is that it is for two things and two things only. That is to go to bed to get your however many hours of sleep, and sex. Typically, the recommendation is that you don't go to bed to take a nap. And the reason is because your body learns that bed is a place to go to sleep. And so your body and your brain think that it's time to go down for multiple hours. If you're trying to catch a 30-minute nap, your body's going to be very confused about why you're getting up in 30 minutes, and you could feel worse than when you went to go take that nap. You could wake up groggy because again, your body and your brain are thinking that it's supposed to get a longer amount of sleep. For some people, napping in bed works. I'm not going to tell you that you shouldn't do it or can't do it. I'm giving you the general guidelines. And then be aware of how your body reacts to certain activities. So if you're doing a bunch of stuff and then it's time to go to bed and you call it quits really fast and you're in bed, again, you haven't had that kind of downtime to get your body and your brain ready for that true rest break. Think about how exercise affects you. For some people, exercising is a great end of day activity because then they're ready to go to bed. For some people, it amps them up and they can't do that before going to sleep. So just be mindful about that. And even when naps do work for you, be mindful about how it affects you long term throughout the day. So if you've taken a nap and you're feeling really rejuvenated and you're able to finish your activities, be mindful about how that might be affecting you trying to go to bed later. Does that mean that you're pushing your bedtime later and later and later? You might want to adjust some things on either side of that, because it could be affecting your sleep. The other rule of thumb is screen time. TVs, tablets, phones, all of the stuff that give off light. I know that some of the newer technology is working on that, and you can change the light function. But again, your brain, when you are looking at screens, is telling you that it's time to be awake and active and paying attention. So if you're trying to do that right before you're going to sleep, that can cause some stress to your body, and then can result in sleep stress because you're restless, you're not able to go to sleep, and then you become uncomfortable, and it's a vicious cycle from there. Some of the causes to having sleep issues can be thoughts. Do I have racing thoughts? Do I have disruptive thoughts? Am I going over what happened in a conversation? Am I going over what happened in the day that did not go well? And so my recommendation to that is to keep something by your bed. If you can write, that's great. If not, keep something that you can dictate so that you can tell your journal, you can tell your notepad, hey, this really is worrying me, but I'm going to leave it here and I'll pick it up in the morning when I'm more refreshed and I have more time to tend to it. Temperature, you want to pay attention to the temperature in your room, and clothing and sheets and bedding and all of that stuff. Pay attention to all of that because that can be destructive for you if it's causing you to not get some sleep. Pain and discomfort absolutely can disrupt sleep. We've already talked about bowel and bladder issues that can disrupt sleep, so we want to be mindful about that. And again, an inconsistent schedule. One of the things that can be helpful, you're going to hear me say meditate a lot. I know that it's not for everybody, but think about meditation however it does work for you. So it can include deep breathing. It can include paying attention to that breath and focusing on that breath. It can also mean prayer. It can also mean reflection. It can also mean coming up with the 3 gratitudes of the day as you're trying to get yourself wound down for bed. So find a way that meditation is productive for you and not necessarily kind of that taboo word. Body scans can also be really helpful as you're trying to get to sleep. If you start head to toe or toe to head, whatever works best for you, you go through each part of your body and just assess, how do I feel? And if you feel any tension or tightness or pain or discomfort, you take a deep breath and take a deep breath in and you exhale and you try to release that discomfort and that tension that you're feeling in that part of the body. And by the time you get from one end to the other, then hopefully you're feeling super relaxed and ready to get to sleep. There we go. So I'm probably not the only one who has, people in our lives that cause a little bit of stress. And if I am, then let me just tell you what to do in case that ever happens to you. But one thing that we do need to recognize is that we cannot change others. I know it's hard to be in that position to realize that we can't change someone else. We also can't change their consideration of your feelings, of behaviors that have happened. We can control how we react to those people and those reactions. So if you find that you immediately get stressed when you're around a certain person, or when their name pops up on your caller ID, you're rolling your eyes and you're saying, "Oh my gosh, I can't handle that right now." You don't have to handle that right now. You are in control of how you behave and how you react in those situations. One thing about the phone is that we do have caller ID. And so we can decide, am I ready to take that call? Am I in the right headspace? Am I feeling emotionally ready for whatever this is? Do I have the time? Going back to time stress, does this person cause stress because they take a lot of my time? You can control when you take or make that return phone call. And that really can feel empowering. It can make you feel like, okay, I'm in control of when I'm going to call them back. I'm in control of when I'm going to talk to them. And I can build boundaries. I can say, yeah, I'm returning your call. I have 10 minutes and stick to that. The other thing is that if you're in an environment where it's not a phone call and you're in an environment and someone is stressing you out in person, my go-to is you have to use the restroom and excuse yourself to go to the restroom. No one's going to argue that, and it gets you away from that stressful situation so that you can take a break, you can take a breath, you can figure out what you need to do next. So those are the things that you are in control of, and that you can own for yourself. And that kind of changes what our expectations are. If we have expectations of other people, that's usually going to get us in trouble. But when we put those expectations on ourselves and say, okay, I'm in control of this and I will decide how this happens, then we feel, again, more empowered. Role stress is something that I talk about a lot with the people that I work with. We talk a lot about what roles people had prior to their diagnosis of MS, and that typically is around work. And so not everyone is still working. Some of you might be, some of you may be students and going to school. But really what happens is that the feeling of roles shifts with the diagnosis, or can shift with the diagnosis of MS, because it can change what that role looks like or feels like, or it can change it completely of what it is. So what I would encourage us to do is to remember that it's important to recognize those roles, even if they were a previous role. It's part of your story. It's part of your journey. Don't dismiss that, but also don't dismiss your roles now. So are you a parent? Are you a grandparent, a sibling, a spouse, a caregiver, a friend, a colleague, a student, family member? Own those roles. Recognize what those are. Everyone has the role of being a patient. Now, maybe that's not something that's a positive role, that I don't necessarily want to take on that title, but it's something to recognize, and it's important to recognize the emotion that's attached to that role. How do I feel when I say I am a spouse? How do I feel when I say I am a colleague? How does it feel when I say I'm a parent? How does it feel when I say I'm a patient? And that's when role stress can really start to shift, when we recognize what those roles truly mean. And some of those roles can come with guilt. Some of those roles can come with frustration. But again, I encourage us to think about your previous roles. Think about roles that you've had in the past. Did you jump into every single one of those roles and were an expert at it? Did you know everything there was to know about that role? Probably not. You probably learned. You probably made mistakes. You probably adjusted. And when you think back to that role, think about how much growth you made, how much progress you made in learning that role. And think about that as you think about your current roles, and especially those that kind of have that negative connotation to them. What opportunities are there in those roles that are opportunities for learning and for growth? And that's how we change the reaction to those role stressors. So now let's talk about reacting versus responding. Yes, there is a difference. So this image shows reaction on the left-hand side and response on the right-hand side. And in general, those images are very, very similar. There's not much that's different, but the parts that are different are significantly different. So we have an event, something that happens, and we interpret that event. We put a meaning behind it. We add emotion to it. We have an emotional reaction or response to it. Happy, sad, indifferent, whatever the case is, but there is an emotional response. And on both sides, there is action. You'll see on the left-hand side that when we react to something, that action, that end result, looks pretty explosive, looks kind of aggressive as it's imaged there. Whereas on the right side, it's in a very stable box. And the reason for that is because when you look at the right side, when we take the time to take a breath and evaluate the event that just happened and the emotions that we are feeling because of that event, then we can process how we're going to respond to that event. Sometimes it's a split second, sometimes it's longer than that, but that evaluation piece that's added on the right-hand side allows us the opportunity to respond versus react. And why is that important? That's important because when we react to something, we're reacting primarily from an emotional state. We're probably not acting based on true information, all the information and calming our emotions. So then we ask, how big is the problem? So I talk in terms of catastrophe and annoyance when I talk about this part of the topic. A catastrophe is something major. We can think about catastrophic events that have happened, that are on the news, that are devastating, versus what's annoying. Now, there are true catastrophes. I'm not here to say that there's not. Are we thinking in terms of our events? So if we go back to this one, are we thinking that events are mostly or all the time catastrophic? Are we thinking that things that happen are the worst day ever? And the reason why I bring that up is because that is usually coming from that reaction side of the image that I just showed. It's usually that it's driven by emotion. And all of that is going to be stressful. And when we are thinking more times than not in that catastrophic thinking style, then we are just building that chronic stress. And when we go back to those earlier slides, that chronic stress can cause some pretty significant challenges for us over time. It also, when we are reacting and we're thinking in that catastrophic mindset, we're jumping to conclusions. We're already anticipating something's going to be horrible before it's horrible, but we've already convinced ourselves of such. So again, being mindful about, is this just annoying and I'm frustrated by it and I wasn't planning on it and it ruined a part of my day or it took it off course, versus it's over. The day is over. It's shot. I'm done. So what do we do? Well, first of all, we have to recognize how we're processing events. Are we seeing these events as the worst case scenario? Are we thinking that it's exploding on us? And so being mindful about that and being mindful about how we are responding or reacting to that. Again, meditation can come into play. Spirituality, prayer, all of those things can be helpful in times that we are feeling overwhelmed and that nothing is going right. Deep breathing, talk therapy, and I put this on here from the perspective of like counseling, but I also want to point out that you don't have to go to counseling to talk about what's going on. I've noticed that if I say something out loud and say, oh my gosh, that was awful, but as I'm saying it, I'm thinking to myself, that really isn't that bad. Like, I can't believe I just said it was so awful. So sometimes I even catch myself to say, why was I so worked up about that? Let's just kind of take a pause and rethink and what caused me to react like that. And so talk therapy can be with another person. It can be with, the person sitting next to you, to say, gosh, that felt horrible. And as you say it out loud, you're thinking, really wasn't that bad. Never mind. I do again, I think I've said this in every one of these sessions. I do really promote journaling, in some capacity, whatever that looks like and how that works for you. Whether that be writing it, dictating it, whatever, but getting stuff down, and out of your head really helps. It's kind of that same concept of, I just said that out loud and it's really not as bad as I thought. Writing it down can do the same thing for you. Or if it really is that bad, it can give you a safe place to keep it for right now. In some cases, catastrophic thinking is because we are also battling with other mental health issues, so such as depression and anxiety. And if that's the case, the medication may be helpful, just to kind of calm things down, to allow ourselves time to think and process versus always feeling like we're amped up, especially with anxiety, or so low in a depressive state that we don't care and everything feels like it's spilling over. So what do we do? Resiliency is something that you may have heard of before. It was a really big topic that we talked about a few years ago. It's kind of a hot topic. But I want to bring it back to light. This image shows what can happen, kind of the wheels turning, and they don't stop turning when we get into an unhealthy thought process. When we have negative thinking, again, it could also be termed as catastrophic thinking, especially when it's over periods of time. We're asking ourselves, how can I live like this? It's a big question to ask. The noise is getting louder, whatever that is, the noise of frustration, the noise of anxiety, the noise of life is getting too loud. And again, we can turn to absolute thinking, which is that all or nothing thinking. No one can help me. Nothing is going to work. There are no solutions. Those are absolutes. We've already put in our head when we are saying those words, we already have the belief that it is all or nothing, which can disrupt lifestyle. We avoid, we isolate, we don't want to participate. We have trouble communicating. We have trouble telling someone what's going on. We have trouble telling ourselves what's going on. That can lead to social and occupational restrictions, disturbed sleep. Sleep is all over the place, and relationship difficulties. And all of that is tied into the emotional response to our negative thinking, which can lead to depression, irritability, anxiety, anger, frustration, helplessness, sadness, all of those things wrapped into one. And that's not a great place to be, especially long term. So we can easily get stuck in repetitive patterns of viewing the world. When we are looking for negative, we're going to find it. If you are in a bad mood, if you have just had a bunch of stuff that you've been challenged by, and you're feeling really frustrated and angry, then we're going to find the negative. We're not going to find the positive, especially if we're not looking for it or inviting it in or taking those moments to pause and reflect. Another thing to keep in mind is to ask yourself, am I a yes, but person? And what that means is that if a suggestion is offered to you or you gather some information that could change the course of what you're doing or how you're moving forward, and your response to that is yes, but the but just negated the yes. So there never is a yes. Because you have already decided that, yeah, I hear you, kind of, sort of, but it's not going to work. So it can be seen as an excuse. It can be seen as that you're not open to change. And in most cases, that is true. Yes, but I'm not open to even trying. When I change that and say yes, with modifications, yes, with some adaptations, yes, let me give it a try and see how it works out. That changes the mindset. That changes how you're going to perceive that. That changes how you're going to approach it. It changes that you're even going to try it. When you take the but out of that phrase and leave it with yes, then you're giving yourself a chance to try something that may or may not work, but I'm going to guarantee you that it will not work if you don't try it. So ask yourself if you can change some of the responses that you have. And ask yourself, are you willing to adjust your mindset and create a positive pattern of thinking? Are you willing to search for opportunities for growth and learning? Think back to that question I asked you under role stress. Were you always the expert at every role you've ever been in? Probably not. So why are we not open to change and learning and growth and opportunities now in whatever role we have today? And ask yourself, when negative happens, or when I feel like I'm more often than not feeling frustrated, sad, angry, how did I get to that? Did I jump to a conclusion? Was I expecting the worst? Was I worried about the future? Was I mad about the past? Am I mad about the present because it's no longer what I had in the past? Think about what your driving force is for those negative thoughts and shift how you're thinking about that. Shift what you're saying to yourself about that. That's how we build resilience. We build resilience by being open to being the best version of ourselves, which will always require some modifications, some tweaks, some adjustments, even on a day-to-day basis. When we are able to be resilient and practice resiliency, it allows us the ability to rebound from negative events and use challenges and setbacks to help us grow. It allows us opportunity to find happiness, satisfaction, and pleasure despite those setbacks. And in some cases, because of those setbacks, you might learn that what I was expecting would be the best case scenario that didn't work out open an opportunity for something even better. But again, when we're not willing to see that, we're going to miss it. Resilience can help us find the meaning and hope even when we are dealing with obstacles. And it says while we're coping with obstacles, we're not coping with obstacles if we're not willing and able to find the meaning and the hope behind it. Find the motivation you need to keep moving forward. Continue working toward your goals. And I have that on here, and I want to point out that that's kind of with an assumption that you do have some personal goals. I hope you do. But if you don't, recognize what those are, identify what those are so that you have that motivation. You have that good stress motivating you and driving you towards change, growth, success. It allows us to address adversity as a learning opportunity rather than a threat, problem, or barrier. And doing that limits the amount of times that we are catastrophically thinking. And it allows us to be open to what's possible. Resilience is not only, quote, bouncing back, but it also means moving forward. And I added that moving forward part on purpose because I don't want us to always think that every time we have a challenge, every time that we feel like we took 3 steps back, that we're always going to be able to take 3 steps forward. Forward is forward. We may not get back to true baseline from where we were prior to that setback, but if we're moving forward, that's resilience. And I don't want us to forget or dismiss forward movement or even sideways movement, because sometimes we need to just shift from side to side to get a different perspective, to see it differently, or to get around something. But movement is the part that's really important. I also really want to point out that resilience does not mean that it's not going to be with some level of grief, of sadness, of depression. Those things will exist even when we are resilient. We're supposed to go through these emotions. We're supposed to feel loss. We're supposed to feel frustration. We are supposed to feel anger. We're also supposed to feel happiness and success and a feeling of accomplishment. That's really what this is about, is do I use those feelings of grief and sadness and frustration to motivate me to make a change so that I feel less of that and more of the positivity? Okay, I know that this is a dirty word for some people. Acceptance is one of those difficult words that I often am greeted with eye rolls and ugh reactions. But let me throw it out there because it's important to talk about. The definition of acceptance is acknowledging and embracing the reality of a situation, whether it's a personal circumstance, another person's choices, or an event that has occurred without trying to change it or wishing it were different. Acknowledging and embracing the reality of a situation, not trying to control someone else, not trying to change someone else or something else, but acknowledging the situation and saying, okay, what do I need to do with this? What can I do with this? Acceptance does not mean you agree with whatever it is or that you're happy with it. That is not the definition. And when we think that that's what acceptance means, then we really do need to change our expectation of acceptance. Because it means that you've acknowledged it, that you have embraced it, that you're willing to work with it, and that you're willing to make movement toward resolution, that you are open to change. That is what acceptance is. And when we reach that level, life-changing. It allows us to feel like we're in more control. It allows us the opportunity for growth and success. And when we reflect back on that part of it, then we have pride. We have excitement. We have passion for the success. Even if we weren't happy about it all along, but we got through it and we can acknowledge that. So now it's your turn to chime in. If you'd be willing to throw in the chat box the answer to what have you found to be the most challenging component of acceptance, I would love to hear from you.
Okay.
You,
Tiffany,
you,
do you want to take these off or do you want me to read them to you? It's up to you.
well, let me see if I can see them. I don't think I have access, so will you read them for me?
Yep. Oh, I don't see any yet. So, but just in case somebody does, I hope they put, that's a really good, a good way to ask your questions. You've given such amazing information. Let's see here. Oh, you're getting some hearts
Oh,
loading up.
It's
Here's your
saying the
Q&A.
chat is disabled
Yep,
for
chat
some
is
reason.
disabled.
So,
Fabio, we need you.
yeah, I'm not sure why, but for everybody for now, until I can fix that, if you can just put it in the Q&A, even that works. And for those watching on Facebook, if you can just put it in the comments,
Yep. I'm
we
happy to
would
read them
love
off.
to hear your feedback. There you go.
So, yeah. Well, actually, it is coming through now. So, somebody is saying loss of freedom. Another person is saying not able to work. Let's see. Letting things go.
So that's always, I try to avoid that statement because again, it comes with a lot of emotional reaction to that. Um, and in a lot of cases, it's not about letting it go. It's sometimes about shifting how we think about that and saying, okay, I'm going to change that. I'm going to change how I'm looking at that. It's not that I'm going to let it go because it was there, it existed. I'm going to acknowledge it, but I'm going to step away from it, or I'm going to change how I'm going to react to that. So be mindful about how that term "let it go" what that means for you, because again, it's part of the story. We don't necessarily want to dismiss it or ignore it or pretend it didn't happen. In a lot of cases, it's important for us to do that, to acknowledge that. It's about how we move from that. That's important.
You know, a couple people have said it's not able to work. That's a biggie.
And so I imagine that you're answering that question in that I'm having trouble accepting that I'm not able to work. And again, that goes back to that role stress. That goes back to I've identified myself as an employee, as someone who was working. That was important to me. I was bringing money in. It causes a financial strain, right? We didn't talk about financial stress, but that's absolutely there. And it's tied into that role of working. So again, finding what your role is now and embracing whatever that is. Embracing that I am me. I am living. I am living this life. And I know that that doesn't necessarily replace, but that's not what we're trying to do. We're not trying to replace a role but we don't want to dismiss what we have today.
Okay. How about my family issue, accepting my condition?
Family accepting the condition, is that what it is?
Yeah.
So that's a tough one. And that's tough whether it's family or close friends or anyone that you're closely connected with. Um, and in some cases, people have decided that they have had, this goes back to the people stress part. Some people have decided that I have to limit my time around others because they don't understand and I'm tired of explaining it. And so in some cases, that might be helpful. If that's not what you're looking for and you want to embrace those people, continue to ask what information can I give you? How would you be willing to learn if you would be willing to learn more about my diagnosis? Oftentimes you can be met with people who are yes, but people. Oh, yes, but you can still do that. Yes, but and you might want to limit your time around those people because that can cause destruction for you.
Hmm. This is actually interesting. The hardest part of acceptance for me, this is from Arian.
Okay.
Hardest part of acceptance for me has been a loss of hope that things will be as they were before.
So that kind of goes with time stress. When we're focused on so much of our past and who we were in the past, then we can lose hope about who we're going to be now or who we are now and who we're going to be in the future. So my recommendation is to embrace what you can do, what you're willing to do, and what you have right now. Don't
Mhm.
dismiss those things. It's who you are. Today is part of your story. 10 years ago was also part of your story. But don't stop reading the book now. We have to know all the information. We want all of the storyline. So don't dismiss who and what you are today based on who and what you were then. Bring that with you. Allow those positive parts and the parts that you do miss, allow those to guide you and lead you to strength and growth and opportunity for learning.
And so somebody is saying that, the difficult part for them is being considered sick or actually a person having limitations. That's difficult for them.
That other people perceive that.
Mm-hmm.
Okay. And again, you don't have to educate the world. Educate the people that are willing to listen.
Mm-hmm.
I'm not sick. I'm not contagious. I'm still me. I'm just me with some other stuff going on. And so I really stress, and this is kind of how I live my life, that I'm not going to die with the most people in my life, but I'm going to die with the best people in my life. And those are the people who are willing to be with me on whatever part of the journey it is, and to embrace that with me, even when they don't understand it fully. Those that are willing to say, I accept you for who you are and what you are today, but that has to start with yourself. I have to be willing to say, I accept me for who I am and what I am today.
Teresa said she has found that the most challenging component of acceptance is simply understanding how to accept the outcome of whatever it is that I am facing at that time. So
So interesting because, and I don't know if she means that the outcome, the perceived outcome or the expected outcome or the anticipation of the outcome. But when we're worried and when we're feeling anxious about what that potential outcome is, then we're missing the process. So being mindful about taking a break, processing it throughout, and not being quite so focused on what the outcome is going to be, because then you're missing opportunities for that growth and learning to guide you towards an outcome that might be better than you expected.
Sheila says having MS neurocognitive disorder is super challenging for her. So,
Absolutely. So I hope that you are finding a way to work with your healthcare provider and build yourself a team of people who can help you with strategies for that. It's important that that we have access to healthcare, that we have access to these providers. And if it's not accessible for you in person, find out if there is a telehealth opportunity for you. But to really work with a team that is helping you find the strategies that work best for you.
yep. And we see loss of independence, loss of freedom. Both of those are biggies.
And loss of independence and freedom, again, those are sometimes we're defining that with what we remember from the past. And so changing the definition of independence. In some cases, I work with people and hopefully try to help them understand that if I have to use a tool, if I have to use a mobility device, for example, that it doesn't mean that I'm less of a person. It doesn't mean that I'm necessarily less independent. In a lot of cases, those tools can help us be more independent. But we have to see it that way. I said have to. If we see it that way, then it changes how we feel about it. Think of them as tools. If something's broken and you need to fix it, you get a tool to go fix it, right? So if we need something to help us live a healthier, more independent lifestyle, then are we willing to use the tool? But I know things like driving, for example, that changes the game. When we're no longer driving, then we're fully dependent on somebody else to, whether it be a transportation company or a person or whatever that case is. And so that can feel like we're less independent and have less freedom. But again, if we have those resources, utilize them. Deb, you're on mute.
Okay. Sandra says that she's asking, will others just see my wheelchair and not see who I really am? Because MS doesn't define me. So
MS doesn't define you, and neither does your wheelchair. It's part of who you are. It does not take away from you being you. It has changed what the visual part looks like, but it doesn't change that you are still Sandra, that you are still the person that you are. And again, maybe I'm just salty or something in my older age, but if people aren't willing to work with that, then again, I'm not going to die with the most people in my life. I'm going to be the one with the best people who see me for me and not for the tools that I need to use.
And Norma said, which is interesting, I don't find acceptance to be difficult. Not accepting doesn't make it go away. So
it does not make it go away. You're right.
Right.
Well said, Norma.
Feeling like the same person on the inside, but treated differently on the outside. So wishing that she could articulate that, that's Sherry.
Say that one more time.
She says, feeling like the same person on the inside, but being treated differently on the outside. So wishing I could articulate this.
Yeah. So if I'm understanding that comment correctly, what I would encourage us all to do is to feel like we are always the best version of ourselves. Because if you get up and you show up for yourself and for the people around you every day, then you will present yourself as confident. You will present yourself as capable. You will present yourself as I'm here and I'm ready for whatever is ahead of me. But when we isolate ourselves, when we're feeling less than, when we're feeling like we're not enough, that's going to come out. That's going to present itself. So changing, that's why it's important to change from feeling those negative, catastrophic, unhealthy thoughts to a more positive, healthy way of thinking. Then we're going to look like we own this. When we are thinking positively, when we're feeling more positive, when we're feeling successful, when we're feeling that we have accepted what today has in store for us or what we've been through today, then people are going to see that. That is going to exude through you externally. I hope that answered that.
Let's see. The continual decline of my physical abilities is really hard.
Absolutely. Absolutely. Because it's one of those things that you wake up every day and you're asking yourself, okay, what's moving today? What's not moving today? What hurts? What doesn't hurt? And so and with that progression over time, what does the next day, the next week, the next month have in store? And again, being present and recognizing what I am working with today can really help us not feel so challenged by the long-term progression or the long-term effects, but what do I have today? What do I need to work with today?
Mhm.
Breaks it down.
And Donna says, which is true, it's not what I wanted. They didn't ask for it.
No. So you'll hear me say that you did not go to the doctor and open the menu and say, oh, MS looks lovely. I'll take one of those. No, we know that. And I hope no one is telling you that you asked for this or that you deserved it or that some karma came back and got you and gave you MS. That's not how this works. And again, when we can find the answer to all those questions, then we'll have a cure. But no, you didn't ask for that. And neither did those around you. You know, if you have a care partner, if you have a family that is involved with all of this, they didn't ask for it either. It's how we work with the unexpected that really shows who we are. It really shows our strength. It really shows our courage. It really shows our ability to deal with diversity and challenges. If we didn't ask for it. You didn't ask for it. But are you willing to work with it? And that's where the acceptance piece comes in.
I know we're at the end of the hour, but I do have another couple questions. Would you mind if we do that?
Absolutely. I would love to.
Carmelita has said, which is, I mean, right on, Carmelita, change in friendships. When people don't understand the disease, chronic fatigue, it changes things, or it can.
It absolutely can. And again, I go back to, we can have discussions and say, are you willing to hear me out? Are you willing to learn a little bit? And hopefully they are. If they're really good friends, they will be willing. They may not completely understand. I'm going to tell you, they're not going to completely understand because no one understands what you're going through. No one understands what anybody else is going through. But are they willing to reach a point where they can say, okay, I trust you. And if you tell me you can't do something because of fatigue, I believe that and I honor that. What can I do to support you? And if they're not that type of friend, then maybe we need to change.
Right. And then I have another one, and we're going to end with this one. Finding a good, effective solution or a tool, an item that's going to help them solve a certain problem so that the next time they're not as challenged. You know, they want to find a specific tool that they can work with, I guess, each time that's going to help them every time get through everything.
So I wish I would knew a little bit more about what we were talking about exactly. But what I can say is that talking to somebody else and finding out what they do to work with that or what tools they've used has been life-changing for the people at the MS Achievement Center that I work for. It's one of the best things that we do. I half jokingly say we open the door and let them come in and talk to each other. But that's probably the best thing that we can offer at the MS Achievement Center is that community. you're going to learn from each other. So sticking to these groups, finding an online group that you can be a part of, finding a community, finding a support group if that works for you, but finding other people who have been through a similar situation, MS related or not, and say what worked for you, and then determine if you want to give it a try or if you want to modify that somehow, but it gives us ideas. And sometimes we learn that there was something out there we didn't even know about.
And I have to read you this one because it's so cute and it's so true. Joan has said that she'd like you to go on tour and she wants to be your tour agent.
Thanks,
Oh,
Joan. I'll call you.
I love that. I love that. So we are at the end of our hour, and that brings us to the end of our time tonight. So if you've missed any part of this conference, it has been recorded and it will be, as always, available through our MS Focus Facebook and YouTube channels. Just reply to your registration email for information on how to access the recordings or to sign up for our newsletter to learn about the upcoming events. Please join us for our next teleconference, which is Tuesday, June 10th at 4:30 p.m. Eastern. And that's going to be Dr. Ben Thrower. And this time he's going to be speaking about managing your MS spasms and stiffness. So as you leave the conference today, a survey is going to appear on your screen. We ask that you just take a minute to give us your feedback on this program and any suggestions for future topics, because we're really looking for things that are meaningful to you individually. So our sincere thanks to all of our attendees for your participation, and especially to Tiffany for sharing, for an entire hour and plus, all your expertise with us. We love it, and you're so kind to everyone. Have a great evening, everyone, and we really look forward to seeing you again next time. Be well.